What
Okay,
it was
it's
like
going.
when Thad first came into the ER.
Well, I got a call from the ER that there was this young 31-year-old man that came in with a significant other, and he was acutely short of breath, and that he didn't look good, and an echo showed that his mitral valve was completely blown out. So when I first saw him, he literally was the color green. He was in liver failure, his kidneys were failing, and he had that look that physicians know well when your life can be measured in hours. And I was holding back and trying to be as composed as I could while I was talking to him, because as sick as he still was able to smile, and he was polite and sweet, and it was just breaking my heart because I didn't want him to know how sick he was, but at some point I was going to have to let the family know how sick he was.
And what was that like, breaking the news to his family? How did they respond?
Wow, it took me a moment to collect myself to even go out of the room and talk to the family. The family was in the room at the time, and I asked them to come out into the hallway so I can discuss it with them. And I don't think they understood initially the gravity of the situation. And when I started talking about his mitral valve and the fact that it needs to have surgical repair, the family thought it was an elective situation, and the family, especially the fiance that I came to learn, was the significant other. And when she heard that he needed surgery, she said, well, we can have it after the wedding, which is going to be in 2 weeks. And I figured that was a good time to segue into how sick he really was. And I informed her, Jessica, and Thad's mother, that he really needs to have the surgery as soon as possible. Otherwise, he won't make it to his wedding.
Can we?
Tell me what it was like when Thad came into the ER.
So when Thad initially came into the ER, he became because he was acutely short of breath. And when the ER physician called me, he said, you're not going to believe this. I have a 31-year-old boy who is with a significant other, and he became acutely short of breath. They did an echo, and the ER doctor told me that his mitral valve was completely destroyed, and he's never seen anything like it. So when I came down to see him for the first time, I walked into the room, and he was literally the color green. He was in fulminant liver failure. His kidneys were failing, and he gave me that feeling that a lot of physicians have when they see a really sick patient, that their life could be measured in hours. And that's how I felt when I first laid my eyes on Thad. Despite the fact that he was literally terminally ill at that moment, he was still able to smile and be polite and appreciative that I was there. And it was really touching to see that.
Awesome. What was it like when you had to explain the news to Thad's family?
It was very difficult explaining the news. I really felt like I didn't have it in me to tell Thad how sick he was. I knew he needed an operation urgently, but I didn't see the value in explaining to Thad how sick he really was, beyond the fact that he needed heart surgery. But I did have to tell the family, and so I asked the family to come out of the room so I could speak to them outside of earshot of Thad, and I explained to them that he's going to need surgery for his mitral valve. And his fiance, Jessica, said, well, we're getting married in a couple weeks, and we'll just do the surgery after the wedding. And I had to look at her and say, which was very difficult, he won't make it to the wedding if we don't operate on him urgently.
And then, how often do you see cases like Thad's, his age, similar to his
Not
age?
often. Oh, in his age group, not often at all. Usually younger heart patients have had an undiagnosed congenital problem that has indolently affected their lifestyle over time, and then they come in when it's reached the point where they can't tolerate it anymore. In Thad's case, Thad had probably a pretty normal mitral valve his entire life. It may have had some weakness to it, but it never affected him clinically. And Thad is an active guy. He's a surfer. He actually was working out really hard to be ultra fit for his wedding. And before he came in, he had been working out, and all of a sudden, acutely, he became extremely short of breath. And that's what happens when you blow out your mitral valve. Now, he blew out both leaflets of his mitral valve. He tore the little cords that hold the mitral valve leaflets in place, and he stretched his leaflets all in one shot. So he had multiple pathologies of his mitral valve.
If this had happened 20 years ago, would Thad have survived?
Most likely not. 20 years ago.
Do you mind just saying if this happened?
Oh, I'm
20
sorry.
years ago?
If this had happened 20 years ago, most likely Thad would not be alive today. And it was a combination of the rapidity that he got to the ER, the ER physician's quick diagnosis, the echo capability that we have, and the surgery that we offer at Boca Regional.
Right. Do you want to say Boca Raton Regional Hospital, or do you just want to say Boca Regional?
I don't want it to sound too
Too
contrived.
right.
You know what I
Make sure we're
mean?
getting it.
And that.
So, what were the main warning signs in Thad, or for Thad?
Well, for Thad, it was the imminent sense of doom all of a sudden after a workout. So in Thad, his presentation is not common. But if a patient or if an individual, before they're a patient, is in their normal state of health and they have acute shortness of breath, the most likely etiology is cardiac. And so medical attention is essential at that point, because any cardiac problem that causes acute shortness of breath is usually a surgical emergency.
If Thad had waited, say, to his wedding, or had continued to wait, I guess he couldn't because he had turned green, right?
Yes, if Thad probably had 48 hours to live untreated. Yes, his liver was failing to the point that he wasn't even making clotting factors. His blood was thin because his liver wasn't able to make clotting factors. His kidneys were not getting enough blood flow to survive. So his urine output was almost nothing, and his kidney enzymes were consistent with someone in kidney failure. He was so weak because of the lack of blood flow that he was barely able to move his arms, barely able to move his hands. It was a struggle for him to even speak to me, and he was still able to smile, which was really amazing.
Gosh, that's unbelievable. He's amazing. He really is.
It's really amazing.
I met him. We spoke with him on the phone, and I just met him in person, and he blew me away.
Really?
He
Oh,
really
good.
did.
See, you picked the right one, because I gave Jennifer a series of potential patients, and she interviewed them, and she's like, "No, there's that guy I like."
Good pick, Jennifer, and Jessica, and his baby, and they're just.
No, I didn't want to mention the baby because they weren't married, and I don't know
Right.
if they're
He
comfortable
did-
with that.
He did.
Oh, he did.
Yeah.
Oh, okay.
He
Okay.
knows a lot.
That's fine. That's Linus, by the way. That's my boy.
Oh, that's a different
Yeah, it's a different one. He's very wild.
He actually really touched on the point. I don't know if you know this, but he actually wrote his son a letter.
I just heard this. I'm glad I didn't know that. Because let me tell you, the other thing was, a blown out mitral valve to that degree, with so many different pathologies with one valve, is typically replaced. I would say almost any center around would have replaced that valve at the drop of a hat. The problem with replacing his valve is that there's two options. There's a mechanical valve option, which requires lifelong anticoagulation, which would not work with his lifestyle. He lifts weights, he runs, he surfs. You'd have to give all of that up if he was on Coumadin anticoagulation therapy. So that was out of the question. And then a tissue valve that does not require anticoagulation in a young male patient who's active, it would only last about 5 years, and he would need repeated surgeries for the rest of his life. So I knew that this was the patient that really, really needed a repair. So we went out of our way to do a heroic repair to his mitral valve. And we had to do a combination of techniques to get his valve repaired that is rarely heard of. But between the team and the nurses, we were able to pull it off, and his valve was repaired efficiently, and it works perfectly. And his heart function has dramatically improved since the surgery. So,
What I was amazed. I actually thought that this had happened like a year ago, and he had told me no, this happened like a couple months ago.
yeah, he wouldn't allow. This is the type of pathology that when it happens, you're laid up immediately, if you even survive.
Right.
You know.
And it would. So I was just blown away though at the amount of recovery that he's come so far so quickly.
Yes. As a matter of fact, his heart had failed so badly because of the strain of the mitral rupture that his heart was only squeezing at 10%, which is horrible. And now his heart function is almost normal. So he's really recovered beautifully.
Do you think you could say that one more time, like all the way through? We'll get
Okay.
a soundbite of it.
Sure,
That
from what
his
part?
heart was, that.
Yes. So when Thad ruptured his mitral valve, his heart could not handle the load that it put on it. And his heart function was down to 10% when I first saw him, which made the surgery even riskier. But the repair went beautifully, and his heart now is almost normal. It's almost completely recovered.
Perfect.
Is it good?
And that's just, that blows me away. Like that's.
It blew me away. It blew me away too, actually. Yeah, I was worried about him. Is he still wearing the life vest?
No.
He's not wearing the life vest?
No.
Oh, last time I saw him.
What's the life vest?
At
Everyone
what-
told us he had that on.
Oh,
and then
that's
Justin
not-
was talking about
oh.
it when he got it off.
Fantastic.
Literally felt like a weight.
Sorry, I'm excited to hear
Yes.
this.
Yeah.
Because the life vest is a vest that you wear that's basically is a defibrillator that you have to wear unless your heart recovers function, or if your heart doesn't recover function in 3 months, then you need an implantable defibrillator. And so he was in that transition period for a couple months where his heart function was consistent with needing the life vest, which is the defibrillator that you wear. And so to hear that he no longer needs it is fantastic, because that means his heart is probably nearly or completely recovered.
He's starting to jog. He was telling me.
Starting to jog?
Starting to jogging. He said, very, very slowly, but he's.
You're giving me
he's just
goosebumps.
starting.
That's
Yeah.
fantastic.
I was really encouraged and excited by
And I'm
it.
telling you, an important point is that he has his own natural valve. It was repaired. And that's, something that it's not common to repair a valve, especially a valve in that state. Because you take a risk that if the valve repair is not perfect, then he may not survive the remedial operation to replace it. So it was a very taxing decision to go for the repair, because I knew if it wasn't perfect, then he might not survive redoing it and putting a replacement in, because that's a lot more surgery, and he couldn't tolerate a lot more surgery.
What is the success rate? Would that be the right terminology with a surgery like this? Is
The mortality for someone of his age with a blown out mitral valve who's in liver failure and kidney failure is 98% in the literature. Yes. He had 3 organ system failure: cardiac failure, liver failure, and kidney failure. And a constellation of 3 constitutes a mortality of 98%, even in his age group.
right?
Yeah.
Can you believe what great shape he was when we met with him?
Yeah.
So he looked really good.
Totally healthy to me.
I know, he really did.
Fantastic. Now they didn't have any pictures of him in the hospital, did they?
No.
Oh.
No.
I mean, of course, there wasn't
I
going to
know.
take a picture of him in the
But
hospital.
we talked about
But,
it.
though.
you know.
They need to clip one in.
We can ask. I'm
I'll
sure.
ask him to see if I asked him to
Just
send me
to show,
everything that
because-
had to do with that in his hospital and everything. It wasn't in there, but
Okay.
Yeah, because
I told you. But before I went into surgery, I reassured Jessica and Thad's mother that he's going to be okay. And she looked at me and she said, "You can't let anything happen to Thad. He has to take care of our child." And it shook me to the core to hear that. And it was a huge, huge weight on my shoulders going in. And I knew I had to do a perfect job. There was just no option but to do that. And I've been doing this a long time, and I can't remember the last time I felt that way going into surgery, where there was no option but a perfect job.
What does it feel like to know that you literally saved a man's life whose son is going to be able to be raised with a father because of a surgery you did?
You know, it's hard for me to think about that part without thinking about how I felt going in, meeting him for the first time, knowing that I was going to be responsible if things didn't work out well. So it's one of those things that still, I'm extremely excited. I mean, I'm overwhelmed with happiness that he did so well. But it's not something I dwell on. I dwell on the entire situation, and that keeps me grounded.
Right.
It really does.
It would be too overwhelming.
It's too overwhelming. I can't just think about, oh, and great, especially since being a heart surgeon is a very humbling experience. And you shouldn't ever just look at your successes and feel that it was just you. The other thing is the team that we have is absolutely responsible as well for getting Thad through this. I can't do heart surgery alone. You need an excellent hospital with excellent staff, and that's what we have at Boca Regional. Without my staff, I couldn't have done it. So it's not just me that feels the way you're asking. The entire team was involved, not just me.
And what role does the family play in, there's a whole team at the hospital. What role does the family play in this process?
They add a lot of anxiety. Of course, we'll edit that out. The family plays a critical role in that the family is there to support. Like when I first met Thad, he was smiling when he met me, and I had to take the family outside to tell them the reality of the situation so that Thad can keep on smiling, because otherwise I would have had to tell the patient, and that would have been very difficult for me and for him going into surgery, having told him what I told the family. So the family is there for moral support and prayer, and it's really important it's really important for the family to be intimately involved in not just the perioperative care, but post-operatively. Patients are motivated by their family members, and having the proper state of mind is really critical in getting through surgery and getting through surgery well.
What, switching gears a little bit, what role does the research of the American Heart Association play into, where we are today, Thad's surgery, the advancements we have, what role?
Sure. The American Heart Association plays a huge role in Thad's successful operation and the life that he now has back. They play a role in the very valuable studies that are done. They played a role in the fact that they played a role in being involved in studies that demonstrated that repairing a mitral valve improves longevity compared to replacing a mitral valve. And so there was extra impetus to know I needed to repair the valve in a young patient because of the research that the American Heart Association has done. They also evaluate surgical techniques and compare them and contrast them, and it's really important to have them involved. Now, you were going to look that up, right?
I'm going to research
All
it.
right, good.
I'm writing it down.
This was,
Huh?
This is not confirmed yet. This is just,
No, but I like it.
But I try to be
If we can
general.
find the basis of the research that basically says you can actually repair a valve, that would be amazing. If
Yes.
I could find it, like the
Yes.
Heart Association
And
finds
the-
it
I can
and
help
repair a
you.
valve, then that's where, I love that part of it because that's what we've been talking about. You repaired his valve, which is a very uncommon procedure, and
I am
not recommended.
sure that you have research, because less people are dying of cardiac deaths, and a lot of that has to do with patient awareness of symptoms, physician awareness, like the American Heart Association's push for women and heart issues. They were largely ignored for many, many years until the American Heart Association came in and brought awareness to patients and physicians alike. My ability to tell people right now about an acute shortness of breath could be a surgical emergency. Not to sleep on it, not to rest on it, because you may not wake up. So the public service and the messaging that the American Heart Association does is also critical, because if a patient has cardiac symptoms and doesn't seek help because they don't recognize them as such, then they can't benefit from the modern technology that we have in the hospital.
Right.
So,
I think that's like a very good point.
you know, because I mean, that I know you guys do a great job. I mean, that's what all the members completely like love, that, you know, gets awareness out there for prevention and for getting treatment.
And even though, you know, we do a great job at that, we have so far to go with it. You know, there's still people, I mean, I meet with people constantly that just have no idea the link. Like, well, I wasn't feeling well or whatever, or my uncle went to sleep or whatever the situation might be.
Exactly.
And even though we do have a very, very far way to come
Sure.
until there's like not one person that doesn't see this, you know.
Exactly.
We need it more in education. We need it more. That's why we're fighting for the CPR.
Oh, right. And that is, I was going to mention that actually, even though it's not relevant to this situation, but you know, CPR is so important. In one day, I had 2 patients, and I was going to tell you about this just for the future. 2 patients in the same day. One was playing tennis on a tennis court, 80 years old, and dropped, and his heart stopped. He was in ventricular fibrillation. His heart stopped. Someone ran up, gave him CPR, and while the CPR was being administered, a police officer grabbed the defibrillator from his car, defibrillated him, brought him to Boca Regional. I operated on him, and he just walked out of here today, 7 days later. That same day, there was a woman who was going to get lunch with her 90-year-old husband, and she just slumped over. She was in ventricular fibrillation, we came to learn later, and he drove her while laying on the horn to the emergency room at Boca Regional, and paramedics outside started CPR immediately and defibrillated her, and she got heart surgery. And she's awake and alert and is going to make a full recovery. So awareness of AICDs, of CPR, is absolutely life-saving. People don't understand that fully, and I agree with you.
They don't understand it until they lose somebody.
Right, they lose someone, and you know, it's just a shame. It's totally preventable. If someone knew CPR in that situation, it's a life-saving technique. You know.
We can, we can use that. Not maybe night of event.
No, I'm just, you know.
But no, we're doing a whole big push for CPR, hands-only CPR training in high schools.
Ah,
We're
wow.
putting
So
forth-
we can use that.
That's a great time to
Yeah.
train people in high school,
Yes.
of course.
It makes it a requirement for them to graduate.
And
Wow.
And
So
that's why I
trying.
had mentioned
Trying.
going into the education system,
Right.
again, apart from this video. But this is actually the 4th year that we've tried. There's 17 states in the US that
Okay.
have passed CPR as a mandate for high
Wow.
school requirement. And we'd like Florida to be the 18th. I think New Jersey just passed it as
That's
number
that's a
17.
great.
It's
We-
great, but it's like you have all these stars, and then Florida, not.
Right.
You know, so
Oh, we
it's
need to
just
change
frustrating.
that. Yeah.
And we have, this is actually, we've lost this 3 times. We're now on our 4th time. We have a bill sponsor in the Senate, and we're working on a bill sponsor in the House. I've
Wow.
actually been meeting with Senator Magar,
Really?
who's just north of us, trying to get her to sponsor it. The issue is, the Education Committee doesn't want to increase the budget. And it's only $100,000 increase.
It's such a
100,000?
small amount of money for the whole state.
For the whole state or just for
whole
for
state,
school?
the
Oh,
whole state,
what?
$100,000.
Oh, come on now.
And so what we're doing is we're running a very, very serious campaign right now to really push for this. But the issue that we have, and this is just something to kind of put on your radar, is we don't have a bill sponsor in the House right now. And we need a bill sponsor, what is it, in the next week?
Yeah,
We need a bill sponsor in the next week or else it's not even be
Well, how do you
voted
do
on.
it?
Well, I'm working with Representative Magar, and that's the closest that we are. Her big issue right now is that the Education Committee has actually said no. So now we're going to work with the Education Committee and really push it with. And I could maybe potentially use it for B-roll for like the news or something like that.
Yep.
Okay.
Of course, I'd let you know if I'm doing that. I would just throw it out there. I'll
Sure,
call you
sure,
and
no.
let you know.
Do I need to say his name?
No.
Okay. So a gentleman of 80 years old was playing tennis last week, and he was doing well in the game. He was actually winning, I understand. And all of a sudden, he fell, just collapsed. And he was unresponsive on the tennis court. People came up to him and shook him, and it was quickly realized that he was turning color, turning blue, and that he didn't have a pulse. And the people on the tennis court knew to start CPR. So CPR was initiated. And during the CPR, while CPR was being administered, a police officer happened to be driving by and saw all this commotion on the tennis court, and he grabbed an AICD, a defibrillator, from his cruiser, ran over to the tennis court and to this gentleman, put on the paddles, and defibrillated him, and got his heart back. Now, he was still unresponsive when I saw him in the hospital, but he started to move a little bit. And we decided to do an angiogram, and he had heart surgery. A week later, he walked out of the hospital. Couldn't wait to play tennis again. So CPR is absolutely critical, and it's just knowledge, and knowledge can save lives. And to not capitalize on that would be a shame, an absolute shame, you know. Because even with the AICD, the defibrillator, he would not have survived because he needed that time of CPR to keep his body perfused to get the defibrillator to him. You know, the defibrillator is not always the answer. You need to bridge the patient to get to the point where they can be defibrillated. And that's where CPR comes in.
What is the percentage, I guess, that you've experienced? I think is it 10% of the time? I think the stat American Heart Association has is 10%